calculate different BMI parameters for the Caucasians and Asians. We have seen that over a prolonged period of time, the comorbidities or the complications in patients who are obese come much earlier at a much lower BMI in Asians than in Caucasians. And that is the reason why we have lowered the BMI to 2.5 for Asians. So for Caucasian is 30 BMI, for Asian is 27.5. Now what exactly happens once you cross the BMI? More and more comorbidities, more and more disease patterns, and more disease and complications keep on setting in your body. So obesity itself is not just a disease that is you're fat and there is a social stigma attached to it, but also it attracts other diseases. It becomes a ground or a play level wherein other diseases can set in. For example, diabetes. And did you know 80% of type 2 diabetes is related to obesity? Cancer. You must have heard that smoking causes cancer, and yes, that is true. Smoking is the leading cause of cancer in humans. But what is the second largest cause of cancer? Obesity. Shocked? Yeah, it's shocking. So obesity is the second largest cause of cancer. It not only causes cancer of the female reproductive organs like the ovaries and the uterus, but also increases cancer chances of the breast, of the stomach, of the esophagus, of the food pipe, when I say esophagus, of the urinary tract, the kidneys, of the large intestine, and so on. It also increases your chances to be hypertensive. Dyslipidemia, that means increased amount of cholesterol in your blood. Joint problems, migraines, asthma, heart attack, kidney problems, joint, backache, and you list anything. The list is absolutely endless. So obesity itself is a killer and is also related to other comorbidities, and that is the reason why obesity has to be treated. It has to be stopped so that you live a healthy and a pleasant life. Now, to address obesity, there are several parameters, or you can say there's a pyramid. So we start with your dietary and lifestyle modifications. The next level would be adding a physical exercise or a physical routine to it. Third would be adding a few amount of drugs. Not that we have seen drugs really don't act on obese patients, but yes, if you're overweight, drugs may help you. And the third or the tip of the pyramid is surgery, which is also called bariatric surgery, metabolic surgery, or in common layman's word, weight loss surgery.